How's it going, everyone? Welcome to this month's Cannabis State Series featuring Oklahoma. Today we have Eric Bowen, which I've had the pleasure of introducing earlier today. Eric, you're a native to Oklahoma, correct?
I'm sorry?
You're a native to Oklahoma, is that correct?
I've lived here since like about third grade. So yes, most of my time has been here.
Yeah, that's great. So Oklahoma native, and traditionally you worked in the hospital path for a couple of decades now. I see from your history,
and almost 30 years.
Almost 30 years. There you go. And you're recently volunteering in a local hospital, which I'll let you tell you about, and as well as your interest in cannabis and how you got into it. This industry is relatively new, and you'll see a lot of younger faces in this industry, but it's great seeing someone who's more experienced with your clinical knowledge and see how cannabis is being integrated into medicine nowadays. So I'll let you take it from here, but just for everyone's sake, this is going to be a live recorded session. More Q&A towards the end of the session. We're going to answer in a discussion format. It's going to be more of an open discussion. So Eric's going to present the Oklahoma Medical Marijuana Program, and then we'll go over some topics that we had talked about earlier. But in general, I like these conversations to be more of a discussion type rather than a lecture, because who wants to be lectured to at 8 p.m. or 7 p.m. on a Monday night, So Eric, with that, I'll let you take it away.
All right. I appreciate it, Alan. Thank you. As Alan said, my name is Eric Bowen, and I'm a pharmacist here in Oklahoma. I'm going to kind of open the meeting with the Zoom meeting with a couple of questions. When y'all think of Oklahoma, what kind of things come to mind? Does anybody have any certain things that come to mind? We'll skip beyond that. How about Sooner football? That's one thing that comes to mind. How about tornadoes? Those come to mind too. But does medical cannabis come to mind? It didn't to me. It's strange, but to walk around and see all these dispensaries now. But back in 2018, Oklahoma voted for medical cannabis. According to State Question 788. I kind of got a little bit ahead of myself here, but I was going to say a little bit about myself. As Alan had mentioned, I'm a pharmacist. I graduated in 1991 with a BS in pharmacy from the University of Oklahoma College of Pharmacy. One thing I didn't think to put while I was there is I also did some research for one of the instructors for a couple of a summer and then a semester just part-time, and so I have some brief experience in research. I worked at St. Anthony Hospital when I was a student, and through pharmacy school to help get me through school and to be able to learn while I was there. I also worked there for a year after as a pharmacist, and while there, I got a lot of experience with sterile compounding, substance abuse and mental health, and some experience in the med-surg arena. My next job was at Midwest Regional Medical Center. I was there for about 23 years. I had a lot of experience with critical care, oncology, infectious disease, and antibiotic stewardship. I was responsible for verification of aseptic technique and compliance with JCO on all of I think there were 23 people I had to test aseptic technique on. My next job was at a rehabilitation hospital called Valor Rehabilitation Hospital. We did a lot of rehabs for like people with stroke or traumatic brain injuries, non-traumatic brain injuries, as well as orthopedic type rehab. And my most current job is I work at a more faith medical clinic, which I've been doing for almost a year now, since July 2020. It's something that I missed a lot when I was in hospital, is the experience with the patient and stuff. And that's kind of that's kind of what got me interested in cannabis a little bit. Is I was missing some of that patient experience. I think a lot of us go through, especially those who've been in a long time, you can get kind of burned out and kind of apathetic at times. And I just needed um, something to kind of reignite my passion and stuff. And by working at the clinic, it's given me plenty of time to do other things like uh, take APHA's medication therapy management course, and I'm actually getting ready to take the certificate program for ISCPH on Thursday. So it's just given me a lot more opportunities to look at stuff and kind of everybody, I think during COVID probably took a look at their life and thought, am I really happy at what I'm doing? And I decided I needed to make some changes. So I've listed my email here, ebo9599@gmail.com, in case anybody wants to get into contact with me. Okay, going ahead. So we talked about the Oklahoma State Question 788. That was basically cannabis was passed by 57 to 43% in favor of medical cannabis. This wasn't a legislative led event. It was like the people brought this as a state question. By this process, that led to the establishment of the OMMA, or Oklahoma Medical Marijuana Authority. That is who oversees our state's medical cannabis program. And OMMA is under the State Department of Health here. So I know in some other states, their program is under different departments than the Department of Health, but I think that's probably the best one for it to be under. Okay, so I'm kind of going to outline the process of medical cannabis certification in Oklahoma, kind of a current snapshot of the program, kind of what pharmacists are able to do here in Oklahoma, and some resources for staying updated. Okay, for patient certification, it's fairly inexpensive. You have to get a reference from a physician, and that can cost anywhere from between $25 to $100, depending upon if you do it virtually or if you do it in person, or depending upon if you do it, which clinic you do with. There's just a wide range in prices. And then once you've gotten that physician certification, they send it in to OMMA, and that'll cost you an additional $105 with, it's actually $100, but then they tack almost $5 in fees on there because they'll only take that via a credit card. So it is available for less, for $25 instead of $105 to OMMA if a patient is on Medicare or Medicaid. Whoops. Yeah, your duration of qualification is 2 years, and then you have to get it updated. This kind of doesn't make a lot of sense to me, but temporary licenses are also available for 60 days, but there's no difference from the full 2-year price, so they're both the same price. So I'm not really sure what purpose that serves. Let me get this up. Minors are also eligible, but you have to have two physician signatures on there. I know that there's some patients that have like seizure disorders or autism and stuff that I know a couple of patients that are on for that. Temporary licenses are good for out-of-state patients. They're only good for 30 days, but they cost $100. In order to qualify for that, you have to hold a medical card in another state and be able to show proof of your driver's license so that they can put that on your card. As far as employment limitations, I didn't go a whole lot into that, but I know that you can't work in the industry if you've had a felony within the past 10 years, and you also have to be at least 21. As far as limitations on what one can purchase at this dispensary, there's not really any limit. Well, there are limits, but they're extremely generous and they are cumulative. The what you can possess is written into the state statutes, but it's also written back on the back of a person's OMMA card for their convenience. And I'll show you on the next page that it says here, kind of about a little bit further than halfway down, it says you can possess up to 3 ounces on your person, 6 mature marijuana plants, 6 seedling plants, an ounce of concentrated marijuana, up to 72 ounces of edibles, and up to 8 ounces of marijuana at your residence. They require that if you're consuming that you have this card on you at all times. And I've heard of people being at events and stuff where they were smoking or something and have had people ask them for their card. So they take it kind of serious. Also, I think it's good on the back of the card that there's the Oklahoma Poison Control phone number right here in the middle of the page, a little bit above. I know 3 or 4 of the people that work there, and they said that there's been a increase in like kids and pets getting a hold of marijuana edibles since we've been legal and stuff. So that's why they put the poison control number on the back. You could also have a caregiver license. It would be like for somebody who's homebound, unable to, maybe in the hospital and is unable to go purchase their own supply from the dispensary. Those don't cost anything as long as you have the caregiver certified with the accompanying patient registration. It has to be the caregiver license also has to be approved by the physician as well. I've seen a few of them. They're a little bit different color than the regular card, and the caregiver, instead of saying patient on it, it says caregiver, and then they have their own ID number as well as the ID or license number of the patient for which they are buying. So that's kind of a double check system there. Just because it is legal does not mean it's been totally decriminalized. However, the most recent part of the statute that I could read about personal possession, it says possession of up to 1.5 ounces of marijuana by persons who can state a medical condition but who are not in possession of the marijuana license shall constitute a misdemeanor. Which, it's kind of silly that it's a plan is a misdemeanor, but that's not for me to decide. I do want to state that they do take it very, very seriously here, though, as far as if you have a card, they'll leave you alone and stuff. But within the past a little bit over 3 weeks now, between April 27th and May 5th, there have been 3 really high-profile illegal grow operations that have been busted by OBNDD, which is the Bureau of Narcotics and Dangerous Drugs. One of these places at least had a grow license at some point in time, but it had lapsed by several months. If you wanted to check out those, they're on OBNDD's Facebook page, and they're pretty active here because I-35 and I-40 both run right through the heart of almost downtown Oklahoma City, and those are, from what I understand, major routes of drug and human trafficking. So I'm glad that OBNDD does a lot of good work in keeping other more harmful substances off the street for us. As far as qualifying conditions to obtain a card, you don't have to have any specific diagnosis to get one in our state. You can put some on there, but it's not necessary. There's places on the actual application for the ICD-10 codes, but like many other places, pain and anxiety are some of the most common things that people tend to use it for here. in order to be certified, the doctor basically just has to sign the statement on the next page that I'm fixing to show you, attesting to whether or not it would be for a valid medical condition. And it says right here in the, the whole thing is whoops, I'm sorry. There we go. It's fairly lengthy statement, but the meat of it is in the italics or in red there. It says, I have determined the presence of a medical condition for which the patient or applicant is likely to receive therapeutic or palliative benefit from the use of medical marijuana. And then they have to sign it. There's no medical records exchange or anything. You can bring them, but it's not necessary necessarily. So patients you have to get your card from a certified provider. And the only people that are able to do that currently in our state are MDs, DOs, and podiatrists that are currently licensed by their respective boards. I did check, and resident physicians are also available, are able to do that. But nurse practitioners and PAs are not allowed to certify a patient for medical cannabis in our state at this point. As far as available products, I guess we have it all. I mean, availability depends on which dispensary you go to. Some are more medical looking than others, which we'll see later. But we've got a ton of them here. You can get just about any type of dosage form that you would want: flowers, carts, edibles, tinctures, even inhalers and suppositories. I mean, lots of stuff here. A lot of the places sell CBD items as well. Some of the things that we're lacking much of that I know that they have a little bit more on the coast and stuff are CBG and CBN, or the acid forms of THC and CBD, the THCA and CBDA. There's just not a whole lot of places that have it. I was talking to somebody the other day, and they said that the main reason for that is they haven't sold well. So I'm going to talk about the current program snapshot of Oklahoma. Kind of give some numbers here. In Oklahoma, we have, this was just as of little over a week ago, we have 368,218 patients. For context, Oklahoma's total population is about 4 million people. So just a little under 10% of the entire population has a medical cannabis card. There's 2,340 caregiver cards, over 7,500 growers and manufacturers, over 1,400 processors, only 24 laboratories. But we have a ton of dispensaries. 2,252 was the latest count on OMMA's webpage. Supposedly, we only have 292 providers in the state. However, on OMMA's page, they provide a list of providers if you're searching for one, but appearing on that list is voluntary or optional. So you don't have to you've got to fill out the paperwork to do that, but you don't have to have your name put on OMMA's website. So likely there's more providers than this, just the 292 that we were just talking about. As far as business licenses, Alan and I were discussing like vertical integration and stuff earlier this afternoon. Oklahoma is a little bit of a deviation from what I've seen in some of the other states. Most business licenses here are actually for single entity businesses, probably about 90%. And while 10% are for multiple licenses, like a dispensary plus a growing license example. Licenses here are comparatively way cheaper than in other states. The figures are outdated because they're from late last year, but I found something that said Oklahoma has the second most dispensaries per capita as of last year, and I wouldn't doubt that it might be going up. As far as the RPH role or pharmacist role in Oklahoma, there isn't one. And I'm going to tell you a little bit of the history behind that. Our medical cannabis state question 788 was passed in June 2018. Well, in July 2018, there were some people that were trying to get some amendments made, kind of backdoorish, let's say, by one of the things that they wanted to ban was the sale of smokable product. The other was that they wanted to add a pharmacist to the dispensary. There's an organization called Green the Vote, and they filed suit against that those two things, stating that that's not what the people voted for. It was the people's initiative, and they actually filed suit against the then Governor Mary Fallon and all 5 members that were on the board at the Department of Health. In addition, there were some accusations of bribery between the then executive director of the Oklahoma State Board of Pharmacy and a Department of Health lawyer. There were some texts that were involved, and the gist of it was they were trying to work a deal to get a better job for the lawyer in exchange for getting pharmacists to be required to work in dispensaries. That kind of was a big brouhaha and was on the news and stuff a lot here. And eventually the Oklahoma State Board of Pharmacy took action and voted to terminate that executive director. So Oklahoma's kind of had a turbulent start in its medical cannabis program. Both of these amendments were dropped because they violated Oklahoma's Open Meetings Act, which states that you have to do that kind of stuff in public and not behind closed doors. As far as what I think was supposed to happen, I honestly believe that there was good intent done on that person's part. It just wasn't done transparently. I know that in the pharmacy, or I'm sorry, in the state, we have at least one dispensary that I know of that is pharmacist owned, and it's advertised as that here at the other part of the city from where I live in. And they have a part-time pharmacist as well on staff for education and stuff. That particular dispensary also has great labeling, which I will show you in the next part. I kind of tried to mark out the name, but the one on the left is an example of the pharmacist-owned dispensary. As you can see, it's got the THC and the CBD contents on there. It's got batch numbers. It's got the grower, the lot number, and then obviously there's not room on all this for labeling all of the different terpenes and stuff that might be in there, but that particular dispensary does. If you ask about their terpenes, they've got it all there for you. It just won't fit on the label. So as you can, but the one on the right is they just kind of half-assed did it, really, to be honest with you. They didn't even fill in all the lines. They filled in the strain up here, and then just how many grams you bought down there. So I'd like to see labeling be a little bit more consistent, and I think that hopefully that we can get some changes coming on that. As far as medical in Oklahoma, and I'm just pointing these out as just a couple of places that I drove by that, I'm not against liquor per se, but if we're supposed to be about medical cannabis, do we really want this portrayed this way? You've got both of these buildings have a door on either side for either liquor or cannabis, and why not have it in a pharmacy? I think that's one of the best things that we can do to maybe to help make that happen is to get involved with our lawmakers, get involved with NORML, you know, the National Organization for, I forget what exactly it stands for, but they're real good about mailing out newsletters and stuff that say it's kind of what's going on in the different states and everything. So, you know, I'm thinking Oklahoma can do better, but I'm wondering, you know, as far as like the United States, should we have to look at something like this when we go on vacation as a key to where is legal and where is not? It's really kind of it's very complicated. You know, we've got two fully illegal states on either side of us, and then the gamut right around me. So Oklahoma's right there. So as far as additional resources for our state, the first resource is the OMMA's website. So it's got a lot of all the state statutes and everything on there. Here's a link to we had some controversy, I believe it's end of last year, maybe last fall, about there's a lab called Fast Labs that was falsifying some of the reporting as far as, you know, they were just making up numbers and stuff to put in there. And so you kind of got to be a little bit cognizant about, you know, what you're buying. So they were falsifying COAs. So we've got some changes coming to our program that's listed here. This actually made the news the last week of March 2021. 2 people were hospitalized due to edibles from another state coming in. And I'm going to go ahead and go a slide ahead. I don't know if you can see it or not, but these are in like commonly used like snack type chip things. And this on these right here, the only thing that you can really tell difference is in the bottom left corner. There's a thing that says THC. Well, if you blow that up a little bit, that says 600 milligrams of THC. That's quite a little bit. And then this is the link to the what happened as far as the Oklahoma State Board of Pharmacy Executive Director and stuff. And for my friends at the Poison Control Center, this just literally happened last week. A student was taken to the hospital after bringing medical marijuana edibles to school. So what I would like to say is to please keep all cannabis products out of sight and locked like any other medication to avoid unintentional effects to children or to pets. And with that, I thank you all for coming, and I'll open it up to any questions.
Wow, that was a lot to take in, Eric. Thank you so much. That was a very great overview of Oklahoma and some of the problems that we see across the country. You know, like it's not just Oklahoma, and the problems in your program that you've identified are not unique to Oklahoma by any means. So with that in mind, if you guys want to type in questions or unmute yourselves, again, this is going to be more of an open discussion. I do have some pre-planned questions. So we'll start there. Eric, in your time working as a hospital pharmacy, how do you see the general sentiment of other physicians and clinical members of the hospital system react to the progression of cannabis used as medicine?
I found that it kind of to be a mixed bag. There are a lot of people that are really receptive to it, and I'm not going to generalize, but a lot of those people tend to be the younger people. Some of the physicians and stuff who are older, depending upon what their specialty is. There's one particular doctor I really want to talk to who worked with a lot of TBIs and stuff at the last place I worked at, and I really want to talk to Tanya and ask her about it, but I haven't yet. But so it's just kind of a mixed bag. I know a lot of nurses are definitely into it and advocate for their patients to be on plant-based therapy as opposed to pills. So I think we're making progress.
Great. And to speak a little bit about the medical program itself, I mean, what you described is kind of, in my term, a little absurd. You know, you don't have any qualifying conditions, which is kind of great. You will have a ton of dispensaries, which allows access to product also. So those are two pros I would actually say about a medical program. But as with all states that don't have a pharmacist on staff, like how do you truly call it a medical program, right? It seems like there's this kind of gray area, this guise of, oh yeah, we're gonna push this adult use industry and just piggyback off the medical conditions and all the evidence and data that the medical literature is supplying. So, how do you feel about that part of this medical industry in Oklahoma?
As far as recreational coming along with it, is that what you're asking me?
Well, it's people treat it more like an adult use program rather than a medical program.
Okay. Yeah, that's somewhat concerning. And Simi, who's also in here in the group with us, and I've talked a little bit about that. She's from Oklahoma as well. Um, you know, your quality of information you get, I've heard of places that are very good as far as providing you information. I've heard of places that want to sell you whatever the highest THC product is or whatever they're trying to move out the door. So, you know, I understand that part of their business model is based on sales, but I know that there are people out there in Oklahoma that are looking for medical cannabis and for somebody to help guide them in the different disease states and stuff, you know, as far as dosing and, you know, drug interactions, you know, counseling, patient counseling, stuff like that. So I think there's a need. I'm just not sure how big the need is.
Right. And even that slide that you had showed in regards to the labeling from, you know, a pharmacist owned dispensary versus the other, that's night and day between what's going to be beneficial, not even just for patients, but a consumer in general to understand the different types of cannabis that they're consuming. You know, THC content is just one small facet of what it takes to choose a correct product for a medical patient. And you know, not having access to those information or not realizing the importance, that's really disheartening to see. So I'm glad there are certain pharmacists doing it. But Simi, right? Is that how you pronounce it?
Yeah, Simi. Uh-huh.
Simi, nice to meet you. I need to connect with you sometime. Just trying to figure out some time in my schedule, but maybe you want to weigh in on that.
Yeah, sure. I'll just introduce myself. And like Eric said, we have been talking. I'm a pharmacist also here in Tulsa, Oklahoma. So Eric's in Oklahoma City area. And I come from a long-term care geriatrics management background in pharmacy. And so I like closed door, delivered out to nursing homes, assisted livings, things like that, people that live in residential care. And then I transitioned into holistic health and wellness, did some health coaching, and opened a yoga studio. I'm a yoga and meditation teacher. And that was kind of my journey getting involved with medical cannabis.
Oh, did she freeze? I think
she might have froze.
All right. Well, we'll see if she comes back. Okay. So beyond that, though, the cap on licenses, I heard there's some legislature in Oklahoma that's going to eventually cap the number of licenses in the state. Is that correct?
I was actually trying to find something on that after we talked today, and I went through like some of the state websites and stuff and like clicked to get updates. But I understand that's true, but I don't know that what number that they're looking for. Okay. I know that that's one of the big problems right now for them. But another thing that they're looking at, and we talked about this a little bit earlier, is just all the regulations and stuff that come with it's called Metric, METRC, a seed to sale type program where you they're just having problems getting into compliance with that. And there's actually a moratorium on it starting. I think it's not supposed to start till maybe July now because I think it's in litigation a little bit. But yeah, there's lots of things that are potentially changing in the Oklahoma industry. But licenses still are way cheap compared to other states.
Yeah, and again, the barrier to entry in Oklahoma seems very minimal. You have to be 25 years old, and essentially 75% of ownership needs to belong to an Oklahoma resident. Is that correct?
I believe so, yes.
Yeah. Yeah. So other states, I mean, I'll give you, for example, in New Jersey, the last round of medical licensing, there was only there were 6 licenses available, and the cost just to apply was $20,000. The application process was hundreds and hundreds of pages of paperwork. So again, the barrier to entry, having it low could be a good thing. But at the same time, when you have too many licenses and too many operating dispensaries and then not enough oversight, that's what happens. Like you guys started in 2018, and to be able to open that or give out that many licenses and become operational, there's no way that the regulations are being enforced or monitored as closely as they probably should be.
I would agree. That's probably true.
Yeah.
I think I'm getting some questions.
Yeah. So Michael's question is, how is the affordability of medical cannabis for patients? Do you have on average for flower products, like per ounce?
It really just kind of depends, and there's sales, I believe, you can look on apps for like Leafly and Weed Maps and stuff like that. But it also kind of varies depending upon, the location. Like the place that I showed you with the excellent labeling, it's a little bit on the upper end of normal, and I think you might be able to get I think a gram goes anywhere between probably about $10 and $13 per gram there. Sometimes you can get stuff like, I see stuff all the time for like $100 ounces or something, but that's not from that place. It's like places such as Cannabis or something that are maybe, not trying to dog anybody, but maybe you're on the lower end of the spectrum as far as what they provide.
Okay, great.
The service and stuff.
Simi, welcome back.
Thank you. I don't know what happened. Yeah, I wanted to mention, so that's kind of something I'm working on, is the endocannabinoid yoga, kind of combining my two worlds. But I met with a professor of chemistry, department head of chemistry at TU today, and this was since I've talked to you, Eric, but he is really interested in medical cannabis research, and was able to, we had a great discussion about a lot of different people in science, scientific and clinical research and clinical practice here that he has networked with, and he's been working with, labs and different like visiting grows and dispensaries. So he's really interested in taking that forward. So for example, housing more like research symposia or things like that with these different, so there's like TU, OSU medical school and some different, and some pain management docs, for example. So that's something that we're collaborating with, and potentially looking into creating like some training at the university, which I think would be a huge benefit, because a lot of the things that I see, so just what I see, it's been pretty terrifying, actually. A lot of when you don't know what you don't know, like a lot of our bud tenders, they're 23 years old. And so people are coming into there and saying, like, I want to get off all my meds. That's something that people say here. I don't know if it's an Oklahoma thing. I want to get off all the pharma and switch to cannabis. I'm like, what are you talking? That's not how this works. And that could kill someone. But there's not any help available. There's not any knowledgeable help available because of the stigma. Like I think that Eric and I, and maybe that pharmacist in Edmond with a dispensary, are some of the only pharmacists I know in this state who will even say the word cannabis, because of the stigma, because of, like, I think how pharmacists tend to be over paranoid, or it makes your paranoia worse over time. And so people are very, very hesitant to get involved. However, so I worked a lot in geriatrics and hospice, and I think hospice, some of the hospice agencies and entities are interested in these things. And because of the opioid crisis, I think there are people who might want to get involved in that, but are kind of working in their area and don't know. And so I would love to see a whole lot more collaboration and talk from pharmacists, scientists, others. And so that's something that I'm working on as well at TU. And so that's pretty exciting, because I think that would and they're that team is interested in all kinds of things, from like the impact of medical cannabis on PTSD and different departments to within the university, to like pain receptors, endocannabinoid system processing, lab testing, different methods for distillation. That I think that's really exciting. And that's something that there's not a lot of medical that I see in a medical cannabis program in Oklahoma. There's not to I personally think that just getting rid of prohibition altogether would be great. But I think that I think there's a huge need and a role that pharmacists and others can provide in what do you do with, like, so I do some like clinical consultations for patients, individual one-on-one. Like, for example, if it's a child and you don't want to give them something that seems like candy, to hopefully help with some, and they've got other psych needs or, complex needs, you don't want to do that. Like, and so finding trustworthy help, I think there's a huge role that pharmacists can and should play there. I think another possibility is just physicians needing to refer, like if someone wants to try medical cannabis, they tell their physician. If they're like okay with it, they're like, okay, go to a dispensary. There's no help available. So networking with physicians that you can send them to a specially trained medical cannabis pharmacist who specializes in this and knows how to help them go through that process safely. And I think there's a huge need for pharmacists to make an impact here. So
yeah, agreed 100% on everything you said. However, my advice to a lot of pharmacists that are looking to get into the industry and don't realize what complexities are is you have to think outside of the box. In this case, us as clinicians, we take a top-down approach, right? So we take what we learned in institutionalized settings and we pair it to the patient, because this is what the research is, this is what the data and the clinical studies are. But with cannabis, none of that has been established yet. Or I wouldn't say none, but not significant enough to be streamlined, right? A lot of the cannabis advocacy actually comes from the patient side, the consumer side. And you have to remember that this is a very consumer-driven industry. We are in our kind of different world where we want to integrate healthcare, but from the general population's perspective, a lot of them still see this as an adult use recreational substance. And it takes those 1 to 2 gems. The entire CBD movement and cannabis movement was started by a lot of pediatric patients, Charlotte Figge and Haley Cox, epileptic seizures. This is how the conversation began. And it has to come from the ground up as well. Getting specific patients that you can take under your wing, that will advocate for it, that will talk to the physicians to change their minds. Because again, institutionalized learning, no one is going to be teaching that right now, and it's in significant amounts. The physicians that have been practicing for 30 years are not going to change their standards of practice because John Doe on the street says it works. It takes a real movement that is comes as a whole. So as a pharmacist, that's what I had a really hard time adjusting to, realizing that I can tell everything of all the knowledge that I had to a specific patient, but at the end of the day, they could choose to ignore me, and they have full autonomy to purchase whatever they want, whatever's on sale, whatever has the highest THC percentage. That's incredibly frustrating as a practitioner to be able to give all this great advice and then not heed it, right? But I understood, and this is what we kind of have to deal with. It's you got to pick and choose your battles, but this industry as a whole is still getting started. Like these meetings in small groups like this is where the conversation happens and the ideas start to form. So I appreciate all the thoughts and opinions that you put on that. Eric, what do you think about that?
I like what she had to say. I kind of wanted to piggyback on what she said about the opioids and stuff. I mean, I think any of us that have been in healthcare for very long have seen somebody or known of somebody who's gone down the road that they really probably didn't want to go to with opioids, as far as addiction and just physical dependence on them and stuff. And just looking into somebody's eyes that is in that position, I mean, it made me want to do something about that. And since I found out that cannabis is such a help as far as reducing opioid consumption, not only that, but it can help with need for gabapentinoids, for muscle relaxers, COX inhibitors, stuff like that. Simi had talked about patients maybe wanting to get off all meds, talking to their the bud tender, but a pharmacist, that it's a little bit of a stretch, but it's part of you could do it as a medication therapy management type thing if you wanted to work with the physician on that. I'm not saying that everyone would be open to it, but just as far as the quality of life that I've seen from people that have transitioned from opioids to cannabis is huge. And I just don't want to see that. It's painful to look into somebody's eyes and just basically see nothing looking back at you. That's a place that, I think if anybody's ever read the book Dope Sick, it's about like the opioid epidemic, and kind of how Purdue kind of deceptively led people into thinking, that long-acting opioids aren't as addictive and stuff. And I remember them putting out, patient education and stuff, pain management education that I, as a pharmacist, had to read. My wife's also a pharmacist. She had to read, and it just was not true. And I think now that more people, we see that there's an opioid problem, our lawmaker, we've kind of gone the other way and made it so difficult for patients to get medicines. People are still out there hurting, but they don't necessarily have to be prescribed just opioids. I just wish that more people were open-minded, and as far as, using opioids along with cannabis, as far as, being able to use lower doses, or, to be able to use cannabis instead of opioids, because, the safety profile is just far, far better for cannabis than it is for opioids, especially long-term.
Great. Okay, so in the chat box, there's a comment. There is, where did my screen go? Hold on one second. So master's program, I'm assuming this is the University of Maryland Master's in Cannabis Therapeutics class. There's also, I think Jefferson College is offering a master's program as well, which is fantastic. I mean, this is how you get conversations happening. Education is crucial at this point, and having professionals more professionals in this space that have beyond just self-taught learning, that's absolutely fantastic. So another question about federal legality. So I mean, your board of this question comes up a lot in conversations, and I actually make sure I ask my host this. And Eric, even though you're not actively practicing anymore, maybe you want to weigh in on some of the concerns that other pharmacists may have in regards to licensing.
As far as their pharmacist license, or?
Yeah, so the question, I can't access the chat box, but essentially is is your pharmacy license in jeopardy because of the federal legalities behind dealing with cannabis?
I don't think it is. I've submitted my all the CE that I've done for last year and this year that I've already turned in. Probably 75% of it is cannabis based. I'm not really touching the product, not really, using my knowledge in the same. I'm not dispensing the cannabis as well. You see what I'm saying? So I look at it as more of an informational type thing. And the way I look at it is if the board was trying to get pharmacists into dispensaries in the first freaking place, then they better not have a problem with it. It's just all it has to do with is patient education, in my opinion. I don't
agree.
necessarily have. I've not talked to anybody at the state board or anything, but did you talk to people at your state board, Alan, or?
Yeah, no, I did not. And that's the exact conversation that Brian, hi, Brian, by the way. I know you're not unmuted, but it's good seeing you here. So yes, his point is your pharmacist license belongs to the state that you reside in or that you're practicing in. From a federal standpoint, there are concerns of, the DEA raiding a dispensary or federal grant funding for institutions being rescinded, but a lot of this has stopped. Back in 2013, under Barack Obama's watch, the Cole Memorandum was one of the key pieces, which I think Donald Trump rescinded it, if I'm not correct, but essentially told the federal government to leave state programs alone. And ever since then, I have not heard about any dispensaries being raided or laboratories or any other cannabis touching businesses. So as far as safety of your license goes, number one, it's a conundrum, right? So being the title of a Schedule I substance inherently says like there is no medical value to this product that you have in front of you. So how can you be practicing medicine with something that is not considered to have medical value, right? Like that's the biggest conundrum that a lot of people face. The second point that I would bring out is that cannabis is relatively safe and effective. There are very limited incidences. There's no direct reports of death related to cannabis consumption. And what we need to advocate for is more of that safe consumption. You don't want to see the packaging like the Doritos container or right. Packaging that's geared towards children. This is all something that we are cognizant about from a labeling perspective. We just need to push this industry to a place where that it builds consumer confidence, but it also builds professionals' confidence as well. Once you start reading more and more about cannabis, you'll realize that it is safe and effective. So I don't fear losing my license per se. I know there are certain insurance carriers now that are the two main pharmacy insurance carriers do not support any cannabis related businesses. And so what's happened now, I've been reading up on a lot of cannabis insurance companies will cover professionals, whether you be a physician, a pharmacist, a lawyer. I don't know the name off the top of my head, but if you do a simple Google search, there's companies now that will insure, quote unquote, insure you. Just keep in mind, this is a new industry. So, who knows if they're going to be functioning 6 months, 12 months down the line. But I have not heard of any lawsuits per se that have happened to physicians, pharmacists that are dealing with cannabis. So maybe if you guys want to chime in on that.
I'll weigh in on that. I think that so there's a huge stigma in Oklahoma. So if you're a pharmacist saying the word cannabis, then you have to stop and think about, you have to be firm in what you're saying, because I think there's employment loss opportunities or employment loss, of opportunity there potentially. But as far as losing my pharmacist license, I'm not worried about it because, like you said, that our state board was trying to get pharmacists into dispensaries. I think it would have to be extreme circumstances for a pharmacist to lose their license with medical cannabis here, such as being involved with, like, because there are businesses here that have legal activity and then underneath it illegal activity. So being who you get involved with, I think, is really important to make sure that they are operating appropriately. I think that if you're doing stuff that's really bad and definitely illegal, then yeah, I think your license could be in jeopardy. But and then the other issue is, like, if you own a pharmacy and collect Medicare, Medicaid, or have a DEA number, then those would be in jeopardy from what I understand, talking to people here in Oklahoma, and I think that would be in jeopardy. But as far as an individual pharmacist losing their license because of working in medical cannabis, I think that would be really outlandish. And especially what I know, I mean, so I was always PIC pretty much. And I mean, it takes a lot for the DEA to get involved with something. If the DEA is getting involved, it is much more serious, right, than a pharmacist trying to help people, with medical needs. And I think our state board here, at least in Oklahoma versus Texas, the Texas State Board of Pharmacy, I felt, was where I lived, was more punitive and interested in, like, kind of maybe making money by fining people. They would have inspectors that aren't even pharmacists, and it's such a big state. But here in Oklahoma, it's very small. They're very nice. It was a totally different experience, and I think that I'm considering just kind of asking them what their thoughts are, but then again, not, because we're pharmacists. We know about drugs. There's tons of physicians prescribing, or not prescribing, but doing the recommendations, and they're not losing their licenses. And I think it would be the worst PR nightmare ever for Oklahoma State Board of Pharmacy to bother any pharmacist about wanting to help people with their knowledge.
Yeah, agreed. And however, on the flip side of that is that we never really know with government organizations. So you leave in the hands of the state or the federal government, and no rhyme or reason. Well, one thing that, if you plan on getting involved in the space, or already involved, is that politics weigh in heavily. Politics and policy making supersede science 110% all the time. So that's just something to throw out there. So back to our other point. So what active measures can we take? And I'll share something that I'm doing in New Jersey, which I think could lay a foundation for something significant, right? The point of healthcare and the traditional, pharmacist verifying prescription route doesn't exist in cannabis, and it may not for a while. Like, true meaningful medical practices won't be necessarily established until the market is a little bit more free, a little less restrictive. So what I've been doing in the meantime is I paired up with an educational institute, or not institute, it's like a program that's given at our local community colleges. NJ Cannabis Certified is the name, and it teaches people about the industry. And my portion that I'm speaking on is on how to educate dispensary technicians. This is really important because these right now are the frontline workers, and it's really important to educate them on things like what they should be saying and what things they should not be saying. So exactly like you said, the highest THC potency is not always the best option for a patient. So if you're working in a medical program, there are certain tidbits of information, general counseling practices that we're very accustomed to, things that you wouldn't think of, like asking open-ended questions, displaying empathy, compassion. These are not something a 23-year-old retail worker may not understand at the end of the day. But if you're dealing with patients suffering from medical conditions, it's a great place to start. So building a sort of, if you want to say, like a dispensary technician, like a pharmacy technician program, where you can go through, how to calculate a tincture dosage, things that people should be capable of doing without diving too much into the medical literature. And bring that to your state board that runs your cannabis program and say, hey, I think dispensary workers should have some sort of handler certification that they have to take. And you be the educating point. You be the change that you want to see happen in the industry. Because right now, everyone's kind of operating on their own leg. But to be able to streamline something, to be able to offer something that like, hey, we have a single source of information coming from a registered pharmacist who's very knowledgeable about cannabis, who's centered on the patient. These are all things that a board of your cannabis board is going to be find useful, and I think that's something that can be definitely done in Oklahoma.
I agree, and I think we need to get involved with our state as well as our national legislators. I've written to a few of them. I got a reply back, on one of them about it, being a gateway drug and all that. But so I think we got some education to do on our politicians too. Saying, hey, you got to look at the whole picture. You can't just look at, sometimes cannabis can be, addictive and stuff, but it also can help people and stuff too. People who other stuff has failed, the people should have access to whatever will help them, get over the symptoms they have. And it's just trying to paint a picture for that politician of, what if this was your mother, or what if this was your son or daughter? I think, making it, personal to them is going to probably be a way to kind of help push that agenda along a little bit.
Right. Agreed. Make it personal. I mean, this is just from experience, but the people that are still citing the gateway drug theory, those are always the toughest conversations.
Yeah. And I mean, Oklahoma, I mean, we're probably one of the most conservative states with the most unconservative medical cannabis law. So it kind of goes, there were two ends of the spectrums, I guess, as far as what the people want. Maybe there's a little bit disconnect between what the politicians think and what the people think. So I think having those conversations is important to do.
Absolutely. All right. So I think we're at time. Eric, if you want to put up your email again, if people have any questions, they can email you directly. But thank you so much for your time, everyone. I love hosting these because I love meeting people from different states. We're a unique breed, being pharmacists that are really interested in not only cannabis, but have the experience, the patient focus. And we want to bring this industry on a different path towards mainstreaming it and being a conversation that you can have with your grandmother, with your future grandchildren. That's the whole point of having these small conversations. So I thank you so much for your time. I don't know actually what state is coming up next month. I gotta figure that out with Melanie. But if you have any questions, Eric's email is up there. And again, thank you so much for your time, everyone.
Thanks everybody for coming. Stimmy, I'll talk to you later. Thank y'all.